Hello and welcome. This 8-minute instructional video is intended to provide basic education and guidance on conducting a proper punch skin biopsy for the SIN1 test. If you require additional training and support, please contact CND Life Sciences for a web-based or office in-service by one of our associates. In this video, we will review the biopsy procedure for the SIN1 test, including preparation, procedure, and shipping. 3 skin punch biopsies are obtained in order to perform the SIN1 test. The biopsy sites include the posterior cervical, taken 3 cm lateral to the C7 spinous process, the distal thigh, taken 10 cm above the lateral knee, and the distal leg, taken 10 cm above the lateral malleolus. First, obtain patient consent to perform the skin biopsies. CND Life Sciences provides a consent form for clinicians inside each SIN1 test biopsy kit. Once consent is obtained, identify the regions of interest for the biopsies. It is easiest to view all 3 biopsy sites simultaneously if the patient is lying on their side. Lay out the biopsy supplies for easy access. Complete the biopsy vial labels and adhere one to each of the 3 provided fixative vials. Once the vials are labeled, open the sterile skin punch biopsy kit and arrange its contents for easy access. Before performing the skin biopsy procedure, sterilize the biopsy sites with the alcohol prep pads provided in the sterile punch biopsy kit. Before the biopsy is taken, the biopsy site must be properly anesthetized. Use a 30-gauge needle to inject lidocaine superficially into the skin. The injection will cause a wheal to form, similar to the wheal that forms in a tuberculin skin test. After 15 to 30 seconds, the needle can be used to gently perturbate the biopsy site to test for adequate analgesia. Once anesthetized, use the 3 mm punch biopsy tool with gentle pressure and rotation until the metal head is fully into the skin. Gently remove the punch tool. Use the forceps to gently grasp the biopsy underneath the epidermal layer. If the biopsy resides inside the punch tool, use the metal probe to gently push the biopsy out and into the properly labeled vial. With the scissors, cut the deep dermal tissue underneath the forceps to free the biopsy from the biopsy site. Be sure to extract as much tissue as possible. Do not grasp the biopsy by the epidermal layer, as this will damage the biopsy. Transfer the biopsy directly into the properly labeled fixative vial and seal. The biopsy should be free-floating inside the vial. After removal of the biopsy, use sterile gauze and pressure to stop the bleeding. Place 2x2s over the biopsy site and cover with a large band-aid. Repeat these procedural steps until all 3 biopsies are obtained. The following 2-minute demonstration will review the biopsy collection process. The distal leg biopsy is performed by a nurse practitioner and narrated by a neurologist.
The patient is kept in a supine position so the left lateral leg can be biopsied and numbed. Measure 10 centimeters from the lateral malleolus. And the area is cleaned with alcohol. And the lidocaine is introduced laterally, parallel to the skin, to create a wheal, as in a tuberculin injection. The patient will usually feel some burning for the first 5 to 10 seconds, and you can see a large bleb appear as 1 cc of lidocaine is introduced. It is best to wait 15 to 30 seconds to allow the area to be fully anesthetized. The biopsy tool is introduced perpendicularly into the skin and twisted from side to side, back and forth, to the full depth of the bezel. Using the forceps and the needle, the piece of skin is removed, grabbing from the bottom so as not to squeeze the epidermis at all. It's then placed into the Zamboni fixative. It's helpful to have an assistant to do this, although it can be done by the PI themselves. Using the gauze, the blood can be stopped very easily, and then use the large bandage to place tightly over the biopsy site, including the bandage. Patients should be advised to keep this area clean and dry for 24 hours. There are no sutures or staples, and the area will heal up on its own.
Upon completion of the biopsies, complete the requisition form and compile the required documentation. If you have questions regarding the necessary documentation, please contact the number on the screen. Ensure proper labeling of each biopsy vial, including patient name, date, time, and biopsy site. After the labels have been reviewed, place the biopsy-containing vials into the biohazard bag provided in the SIN-1 test biopsy kit. Place the biohazard bag and the compiled documentation into the insulated SIN-1 mailer and seal. The sealed SIN-1 mailer is placed inside the FedEx shipping pack. Place the overnight return shipping label onto the FedEx return pack in the designated area. Finally, contact FedEx using the number on the screen to arrange a same-day pickup with next-day delivery. It is important to remember that all biopsies must be shipped the same day that they are collected. Extended exposure to the fixative solution may affect the outcome of the SIN-1 test. If you have any questions, please contact CND Life Sciences at the number on the screen. To order SIN-1 test biopsy kits, fill out our kit request form on our website or call CND Life Sciences. Thank you for listening. We hope you found this video helpful. We encourage you to contact CND Life Sciences for additional support, including web-based guidance and office in-service visits.